Across Kestria Global Life Science and Healthcare Practice Group, we work with leaders navigating an increasingly complex and high expectation environment. The pace of change is accelerating from scientific innovation to workforce transformation, but so are expectations from patients, regulators, and stakeholders. 2025 marked a critical shift from promise to proof, where real-world impact is now expected. AI has accelerated discovery, but it has yet to consistently improve clinical success. In this context, success is no longer defined by strategy alone. It is defined by leadership and by the ability to build trust in uncertainty. And that's exactly where authentic, future-ready leadership becomes critical.
When we talk about authentic leadership in healthcare, it's often misunderstood. It's not about being informal. It's about consistency, clarity, and integrity. In highly complex scientific environments across drugs, devices, diagnostics, and AI, leaders are constantly operating at the edge of what is known. Staying at the forefront requires not only expertise, but also humility. The leaders who build trust are those who understand their strengths, recognize their blind spots, and challenge them openly. And they don't do this alone. They rely on diverse, multidisciplinary perspectives, because in an increasingly complex environment, authentic leadership is not a soft skill. It's a discipline that drives trust and performance.
In life sciences and healthcare today, innovation is no longer the primary bottleneck. Translation is. Across organizations, we're seeing extraordinary advances in science, technology, and data. But the ability to convert that into real-world outcomes is where the gap is emerging. At Kestria, working across markets and mandates, we consistently see that the challenge is not expertise, it is integration. Organizations are no longer looking for leaders who can operate within disciplines. They're looking for leaders who can move across them, connect science, clinical, regulatory, and commercial thinking, and align teams towards a shared outcome. Because impact in this industry is defined not by discovery, but by delivery.
Being a future-ready leader in healthcare today means more than responding to change. It means anticipating it and building organizations that can evolve continuously. It requires comfort with ambiguity and the ability to provide direction even when clarity is lacking, while fostering trust. At Kestria, we work with clients across the full life sciences and healthcare landscape, from research and development to operations and market launch. Across this complexity, one pattern is clear. Leaders are judged not by what they say, but by how decisions are made and how organizations truly operate. Future-ready leadership requires transparency, alignment, and the competence to lead through complexity, without oversimplifying it.
At Kestria, we see firsthand how leadership shapes the future of organizations across life science and healthcare. The leaders who stand out are not only those who build the best products or technologies, but those who build the leadership structures that can carry them forward. When the people dimension is right, organizations gain the clarity and confidence to scale and adapt. Because what connects people, trust, purpose, shared ambitions, is always stronger than what challenges them. Authentic leadership builds trust, and trust is what ultimately drives impact for organizations, for teams, and for patients.